Hi, I'm Chris Koenig, President and CEO of the Niagara Lutheran Health System, and today is May 21st, and here's our weekly update. Good news, we don't have any COVID positive patients or staff members in the facility, so we continue to not have community spread, which is great. So we're really proud of our staff, proud of our infection control policies and our medical advisorship and our board for everything that we've put into place to keep everybody safe. We do know that this is kind of a finicky disease, a virus, and that could change, but as of right now, we're in great shape. We did start testing staff members yesterday in accordance with the governor's executive order. We are working with a laboratory called KSL. They had the capability and the lab technicians to be able to come in and do hundreds of tests in a very short time frame. So we're doing an oral swab, which is great. So the staff members weren't too keen on getting stabbed in the back of the nose twice a week. This is a lot easier to tolerate when they need to get that test. So it is underway. A couple notes on that. Just with the sheer volume of tests that we're going to be doing, which is going to be near 1,000 every week, each test has something called a specificity and sensitivity. So that's statistically how good the test is at testing for the virus. So whether it's good at finding the virus and diagnosing it, or giving you a false diagnosis. So no test is perfect, so the higher the volume that you do, the higher your chance of creating false positives. So unfortunately, with the specificity even being over 99%, if it's 99.5, 99.8, that still leaves between 2 and 5 false positives that we will get per week. Our staff is still screened every day they come into work at the door, temperature checks, a symptom check to make sure that they're appropriate to be allowed to work, or they're not allowed to come in. So we've been very strict about that. So I know they're worried about people passing the virus that are asymptomatic. So we certainly could have people asymptomatic test positive, but statistically we will have false positives. Those are going to be treated as infectious, obviously. So if we do have positives, our staff is going to be sent home to quarantine for 2 weeks, and they're not going to be allowed back to work until they have a false test. If that does happen, and we do have a positive, we will have to inform all the family members in the entire building. So like I said, I assume this is going to happen regardless, just by sheer volume. So don't be alarmed. We're still doing everything we need to do. In regard to patient testing, we did get word from the Department of Health this week that they will be by to test the residents at Greenfield Health and Rehab sometime. They didn't tell us when. And the same goes for that. With 160 residents, statistics do say that some of them will likely turn up positive. Once again, we're still doing quite well. We're one of the only facilities in Western New York, campuses for that matter, that I could say we don't have any cases. Not that we haven't been affected, we've certainly been affected, but there are currently no active cases, and we hope that continues. I did receive a wonderful question from a woman named Juliet, whose mother I believe is here on campus, and that wanted me to talk about looking forward. So what is it that our plans are for when things start to open up? A lot of what we do here is directed by the governor these days. So the executive emergency powers that he has, there's not a lot of checks and balances. So when we get an executive order, we don't have a choice but to follow it. So most of what we do is dependent on the Department of Health and their advisement from the governor. Things are changing literally every other day. We're getting new executive orders. We're getting new guidance from the Department of Health. A lot of times it's different from what we got last week. For example, we were allowed to test for antibodies for staff. There were some facilities that were going to test antibodies this week, and they had to start on Wednesday, and Tuesday night they got a letter saying you can't test for antibodies, which means they're now not in compliance with their plan for the state. So it is quite hectic and hard to follow. So most of looking forward is going to depend on what the state allows. It's not going to follow the phases of the government or the state opening, so there's no talk about nursing homes in phase 1 through 4. So when a restaurant opens, it doesn't have an impact on our dining services here on campus. They're still held to a different standard through the Department of Health. I do want to keep the residents as safe as possible. I think it's everything that we've set in place that has kept them safe. But I'm absolutely with you that I think the isolation has a detrimental impact. We're doing what we can to make sure that the patients don't feel as isolated, even though we don't have group activities. We're still doing social distancing, and one of the things we did start doing after we checked with the Department of Health is it's warm, so residents can go outside supervised to make sure that they're abiding by social distance, but also that nobody comes on campus and gets in contact with them, because say somebody's driving by to drop off clothes to somebody in the manor, if they see people sitting outside and they think it's okay to approach them, we need somebody to make sure that doesn't happen. So we're taking our time, we're doing certain liberties that we can when we can. The other important thing to keep in mind with the visitation as well, since it is warm outside, there will be residents from the manor moving around the campus. This is their home, so we have to make sure that that distance is between the facilities as well, between the manor residents and the health center. So we're doing what we can, but we certainly are looking forward to the future and being able to do what we can. But in the meantime, we've modified things, by video. For example, what we're doing right now. We're doing the same thing for the residents. So we have activity staff that literally works from 8 a.m. to 4 p.m. that their only job is connecting the residents of the campus with family members or friends. We actually have some volunteers that want to start talking with the residents as well from their own homes, which I think is just wonderful, because not everybody has family that they can talk to. But the staff, once again, has stepped up. We've repurposed the staff. So, for example, therapists. So we don't need as many therapy hours because we don't have as many orthopedics patients as we used to. So the therapists are helping with the long-term residents, so they're with them most of the day. And actually, we've had a great reduction in falls because of that. Our activities departments and the other facilities, our drivers are doing different things. So they're interacting with the residents to make sure that that isolation doesn't feel as bad. We do get a lot of feedback from manor residents that they feel safe here and they're glad they're here. And they're not home alone in the community. So the isolation that some of these residents may feel here would be vastly different if they were in their own home. So at least they're in the manor with 92 other residents that they can still see each other here and there passing through the halls. There are still, light, socially distant groups below 10, things that are still going on. The governor's going to allow worship service for groups under 10 shortly, so we'll be looking into what that means on campus. So worship is very important to the residents of campus. So we do have we're moving towards a full-time pastor here on campus, Pastor Kruger as well. So that'll fulfill some of the needs that the residents may not be getting otherwise. But we certainly are looking forward to when we can open up, and a lot of that is going to be determined by the Department of Health, but also the safety of the residents. So does that mean a vaccination? I'm not too sure, but I can tell you there's been some great news this week in terms of treatment for COVID that I'm looking forward to, because I worry about it just like the rest of you. The residents are my friends. I've been here many years, and some of these folks have been here a lot longer than I have, and they've taken me in, and it's been meaningful. So the relationships I've built with them, we all care deeply about them. So I guess the report this week is good. Nothing bad to report. Like I said, that could change, but we're doing everything we can, and the staff and the residents, I can tell you once again, their moods are pretty good considering. I think they like the fact that people can come to work. They can come to work safely and know that everybody's checked to make sure they're safe, and they can have some interactions, and they like that they can interact with residents, because when our staff goes home, they're isolated as well. So when I say that your family members are family members, it's the honest truth. They're all we have right now as well. So everybody's doing what they need to do. So that's it for this week. Thanks, and I look forward to talking to you again next week.